The Roper St. Francis Health Services Center is a comprehensive sexual health care provider providing patients with critical resources for their care. Today, I talk one-on-one with the director of the center, Dr. Tawana Brown, for this edition of Quintin's Close-Ups for this 3,000th interview. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Dr. Tawana Brown, welcome to Quintin's Close-Ups for my 3,000th interview. 3,000 interviews. Wow. Praise God in heaven.
Congratulations on that.
Well, thank you. Thank you so much. I really do appreciate it. And needless to say, Dr. Brown, obviously you're the executive director for the Roper St. Francis Health Services Center, which is a comprehensive sexual health care provider reflecting a commitment to total wellness and high-quality patient-centered care. Tell me, Dr. Brown, what's new, what's now with the Roper St. Francis Health Services Center?
Well, I'm very proud to say that Roper St. Francis Health Services Center, formerly the Ryan White Wellness Center, has been in business for over 20 years here in the Low Country, offering over 25 services to people living with HIV. I'm so proud of our team here. We have an amazing team, and on site, we just to talk about a few of the things that we have on site.
Yes, ma'am.
We have our own on-site dental program. We have an on-site vision program. We have an on-site behavioral health program. We have a food pantry. We have a clothing closet. We really try to wrap our arms around and treat the entire total patient. I always say our patient is not just a slice of pie, but the whole pie. So we try to meet all of their needs, because we know that if we can meet all of their needs, their ancillary needs, then their healthcare will stay intact. We also have a housing program here. For us, housing is healthcare. So we know that if patients are not stably housed, then they cannot attend to their medical care. So that's very important to us as well. We have about 50 teammates here. We have social workers, we have medical providers, we have nurses, we have medical assistants, we have therapists. We just have everybody here really trying to meet our patients at their very point of need. Another thing that we have here that I'm so proud of is our prevention program. So we have a mandate to end HIV by 2030. The only way that we're going to do that is through prevention. And so we know that patients are still becoming positive. HIV is still very much relevant. On average, we're seeing about 20 new patients a month. So what that tells me is that we have plenty more work to do in the area of prevention. And so we have a stellar PrEP and PEP program here for people that is little to no cost. So if you don't have insurance for either of our services, for our HIV care or our prevention program, you can still be a patient here. And we offer PrEP and PEP. We also offer STI testing, free and confidential. We also offer prophylaxis here entirely for free. So we are really trying to help not only end HIV, but also provide good quality care. And we serve the 7 counties here in the Low Country.
And I want to talk to you more about that in just a second, Dr. Brown. But let me ask you, what is the biggest difference about the Roper St. Francis Health Service Center from 20 years ago to right now?
Wow, I think the biggest difference that I can name is just how far we've come in the area of HIV research and care. And I'm going to age myself a little bit, but when I first started working in HIV care, there was about one pill regimen on the market that people could take. It was called the tripler. Now we have several, over 3 or 4 one-pill regimen on the market. So no longer are the days where people have to take 20 pills a day, or, some people who have aged with HIV just told me the other day, like, Tawana, I remember what I would have to take 10 pills every 4 hours. That's gone. And so that, I think that's the biggest change we've seen over the years, that it's just more tolerable. The medication is more tolerable, and people can take 1 pill once a day. That's it.
Well, thank God for that. What exactly are the patient's needs and wants right now?
I think our major concern here, just like every other social service organization in Charleston, is housing. Housing is a epidemic in and of itself, because affordable housing in Charleston is hard to come by. I think the last time I checked, the average rent for a 1 bedroom now in Charleston is around $1,800. Well, we know in order to qualify to stay in a place that's $1,800, you would have to make twice the rent, or 3 times the rent. So times 1,800 times 3. And that's how much you would have to make a month. So most people don't make that in a month to even qualify to live in some of the places here in Charleston. So I think one of our biggest concerns right now is affordable housing. Affordable housing is definitely something that we are focusing on because there's not enough of it.
Let's just dive right into that. I mean, I talk about this all the time on Point This Close Ups with the politicians and community leaders. So, where exactly do you need affordable housing right now for your patients?
Everywhere. We need affordable housing in Berkeley County. We need affordable housing in Charleston County. We need affordable housing in Dorchester County. We need affordable housing in the Low Country, period. It's just not enough. And it is and I don't want to make it sound like doom and gloom, because there are things in the works where we are trying to make sure. I sit on a youth homelessness task force along with 180 Place, and we're trying to really make sure that youth are stably housed. So it is things in the works, but it's still not enough, because every time we get, I think they said one new person moves to Charleston every 20 minutes. So every time we get these new people, these coming from other places, and some of them are still working remotely, so they're driving our economy up. Is really not matching, what the average prices of housing is around. And so we need housing all over the Low Country, all over the Tri-County area.
A better question for you, Dr. Brown, is this. You just mentioned all of these people were moving to Charleston 20 minutes, every minute, 20 minutes that is. So how does your center keep up with this growth, with smart growth?
Well, one of the things that we do, we have a grant that we've had for over 18 years through the city of Charleston, is our Housing Opportunities for Persons Living with AIDS grant, and we use that to assist with housing. We also fundraise to assist with housing, because even though we've been getting that grant for over 18 years, it's still not enough, because I just told you how much housing costs. So it's still really not enough. One of the things that we have done, we have partnered with pastors to create a master lease program. I'm so proud of our master lease program. And so what that simply means is we hold the lease for 2 units for 25 years. And so we cover the total rent, utilities, etc. for those units, and we can control whom we let in the units. And so, for example, if you might have a bad rental history, or if you don't make 3 times the rent, that would not be a barrier for our units. And so I am still always looking for other organizations to partner with in order to get some of those units, and also looking for funding to cover those units. So we are going to continue to partner with pastors to hopefully get some more units, but with more units, we need more funding. And so we are always fundraising. That's another part of what we do. We have 2 major fundraisers a year in order to cover some of those costs, along with other costs for our patients.
And I remember growing up on the east side when Pastor started with, obviously Jimmy Gallant.
Yes.
and those fellas there when they had midnight basketball. And so that's a great organization here in the Low Country. So how many units do you actually need to keep up with this growth now, Dr. Brown?
I mean, if I could have a whole apartment complex, I would be so super duper excited. That is just the amount of units that we would need to keep up with the growth. The growth is just so rapid. So we're always trying to catch our breath, trying to keep up, trying to ensure patients are safely housed. A lot of times people come to us and they're homeless. So we start out at a deficit with them, and it's like, okay, let's try to get you in housing first, because we know that if we can't get them in housing, they're not gonna, one patient comes to mind who is chronically homeless, and we would make sure he got his medication and everything, but then his backpack would keep getting stolen. And, when he would, stay in these different tent cities around town. And so then his medication would be missing, and we have to reissue it. And so you see what I'm saying? Housing is such a key part of health care for our patients, right? Because our patients have a chronic disease that they have to take medication every day for, so they need to be in a stable environment to do that.
And how many of those people who are actually homeless actually need medicine or resources from you all?
All of them. Because if they're HIV positive and they're homeless, they need the resources from us. So it's just hard to put a number on the amount of, well, I would say this. So on average, we are helping about 20 to 25 people a month with some type of housing need, whether that be rental assistance, utility assistance. I just need help finding an affordable place. Do you have a list you can help me with? Or sometimes if the Section 8 list opens, they would need us to help them sign up for that. We also have a tenant-based rental assistance program, which is funded by our grant through the city of Charleston, which is like a Section 8 voucher. I would love for us to have some more open slots for that. Right now, we have 30 slots and we have a waiting list for people wanting to, right? Because see, once people get on that voucher program, then a lot of times they can't afford to move off of it because they can't afford 3 times the rent. So it's like a cycle.
Yes, it really is.
Yeah.
Besides the medicine and obviously housing, what else do your patients need right now?
Well, we need our funding to continue so we can keep offering our patients the high quality service that we do. One of the things, like I said, you can come here if you're insured or uninsured or underinsured. And so we are a grant funded program. We are funded by the Health Resource and Service Administration, which is funded through the government, that helps us ensure our patients have medication, that they have medical care, etc. So that is something that is always important. Without HIV medication, somebody can potentially die from complications of HIV. And so medication is so very important. That's like the cornerstone of the work that we do. And so right now, we just want to be able, our patients to continue to get their medication.
Absolutely. And Dr. Brown, let me ask you from a compare and contrast perspective, how many of your patients are insured versus uninsured?
That's a good question. So we probably, so right now we have about 1,000 patients. I would say that 90% of our patients are insured, but let me tell you why.
Yes.
They are insured because of now we have the Affordable Care Act. And so with that, we are able to assist people with those insurance premiums. So we have been able to put people on insurance that have never had insurance before. So that's another part of our programming. We are able to, we have about 350 patients on ACA or Obamacare who had never had insurance before. And our program is able to fit the bill for their premiums.
Wow. And what other premiums do you hope will become available for these particular patients who are in need right now?
Say that again one more time.
Yes, ma'am. What other premiums do you hope will come available or come online in the next couple of years for those people who really need insurance right now?
What I would hope is that we can continue to have the Affordable Care Act here in South Carolina. Well, what is the federal legislation? So I would hope that we can keep our Affordable Care Act, because that is a lot of the, that is not a lot. That's really how most of our patients have become insured who never was able to get insurance. Because a lot of, before the Affordable Care Act, you could not get insurance if you had a pre-existing condition. Right? Now you can get insurance, right? Sometimes the premiums are a little high, but we're able to cover that. So I think what I would love to see happen is that we can continue to provide insurance via the Affordable Care Act or some other equally, great program where people can still get insurance.
And how many of your patients actually come to you all, obviously with, preconditions and actually have issues with HIV?
Well, all of our patients that come to us have HIV because they're coming to us because they have HIV. I really don't know the number in terms of how many of them have pre-existing conditions, but HIV is considered a pre-existing condition. So I wouldn't really know the exact number of people that come to us with other health conditions, but they do. And so what's great about them having insurance is because we only can see them for HIV, but because they have insurance, if they have kidney disease or if they have high cholesterol or if they have diabetes or whatever the case may be, they can go and see another provider with the insurance that we help them provide.
And you talk about obviously those existing conditions. What are those other medical trends that you and your team are keeping an eye on right now?
Definitely, we always keeping an eye on diabetes for sure. We are always keeping an eye on kidneys, right? Kidney failure, because if you prolong use of HIV medication can cause kidney failure. So the docs are always keeping an eye on that. Definitely keeping an eye on cholesterol. But I would say the two big ones that they normally keep an eye on is kidneys, diabetes. Those two.
And when it comes to those actual HIV medicines that help improve someone's health, Dr. Brown, what are those trends that you and your team are looking at from that perspective?
I think that HIV medication has come so far that most people who take their HIV medication consistently, they don't really see a lot of other health conditions as a result of HIV, if that makes sense.
Thank God in heaven. So let me ask you this. What's next for the Roper St. Francis Health Services Center, that is?
Well, I think what's next for us is definitely we've already rebranded. We used to be called the Ryan White Wellness Center. We rebranded in order to kind of take the stigma out of what we do because we just don't help people with HIV. Of course, we also have our prevention program. So I think what's really next for us is expanding our housing program because we know that's a big deal here in Charleston, and also expanding our prevention program. Without prevention, we'll never see an AIDS-free generation. We still have many people coming to us at the age of 18 still, testing positive for HIV. And for me, that's a problem. That means that the message is not getting out there. Like we are not, it's something that's a miss. One of the things that we are working on doing now too is expanding into our rural areas. And so having like a satellite clinic, we will have a satellite clinic in Berkeley County here in July, coming up in July. So I'm really excited about that because in our rural communities, people have little to no access to care just because of transportation issues, you know what I'm saying? And really not being able to get out of those rural areas to come to care. So we're coming to them. And so we are piloting that right now in Berkeley County, and I hope to expand in other rural areas. So if they can't get to us, we can get to them. Roper St. Francis has a mobile unit now, and which is a part of our community health department. We are a part of the community health department, and we always have representation on our mobile unit, which has been really, really great addition to our service offerings because we actually found an HIV positive person on the mobile unit that we might not have otherwise found if we wasn't testing on the mobile unit in a rural community. And so we really want to make sure that we can extend our services to mobile, not to mobile, to rural, rather extend it to rural communities. We want to definitely expand our housing program and expand our prevention offerings. I want to see an AIDS-free generation in my lifetime. I always say I got into this field to work myself out of a job. And so I want to see that. And I think we can get there.
What's missing with the message?
I don't know. I think so it's a catch-22, right? Because HIV medications are so great now, HIV care has just expanded over the years. People don't see people dropping dead from AIDS like they did in the 80s. And I think that has hurt us a bit because now people don't believe that HIV still exists. Or if I get it, I'll be fine because they got medication, I can take it and I'll be fine. I think that's, to me, I think that's what's the missing piece because people are not dying like they used to. And so then people don't pay attention as much, maybe. But I still want people to understand that HIV is still around. Yes, it's a chronic condition that if you take medicine, you would be fine. But if you don't have to do that, why do it? They have PrEP now, which if you take PrEP, it's the same way. You take PrEP once a day and practice good, safe sex, then you would never even have to, HIV would never even be a thing for you, an option. So I think that's just missing in the messaging. I think it's just care and treatment has gotten so good over the years that people forget what it was like when HIV first came around. If that makes sense.
And Dr. Brown, I want to go back to the rural areas because I love the rural areas a lot on Cullenville, those places, Hollywood, Ravenel. So,
Mhm.
what are those other targeted areas in the rural areas that you want to expand your services to right now, besides Berkeley County?
So we only serve 7 counties. That's what our grant allows us to serve. So Horry, Williamsburg, those counties we want to expand to, because so those are some of our rural communities that we can serve. I was just out in Georgetown a
Yes,
couple of weeks ago
love
for
Georgetown.
something unrelated to this, and it was like, yes, we want the mobile unit to come out here. Yes, we want you all to set up testing, because not only do we test for HIV in a mobile unit, but we screen for everything else. We screen for cholesterol, diabetes. You can sign up to get a mammogram. Like, we do all of that on the mobile unit. And so those are the other counties I would like to see. Colleton is another county that we serve. That's probably going to be next on our list after Berkeley to expand to Collington. So yeah, Berkeley, Colleton, Williamsburg, Horry counties, those are the counties that we can serve, that we're looking to expand in those rural communities.
Yeah, I love it out there in Williamsburg County and Georgetown County, of course. Love Georgetown, great area.
Yeah.
But let me ask you, how many of those people do you all see, particularly for HIV, on those mobile units?
Well, people don't come on the mobile
Right.
unit for HIV care. They come for screening. So on average, we probably screen anywhere between 5 to 10 people each time we go out with the unit. We have a beautiful prevention coordinator. Her name is Chrislyn Williams. Chrislyn is mostly always on the mobile unit when it's out, and she's screening for HIV.
That's amazing. Glad to have that. I love seeing it around town, by the way.
Yeah, we're on there. We're on there for sure.
Absolutely. Well, Dr. Tawana Brown with the Roper St. Francis Health Services Center, thank you so much for your time. And again, welcome to Quintin's Close Us for this 3,000th interview.
Thank you so much for having me. I am honored to be here, and I'm always willing to share and spread our message. And last thing I'd like to leave you with is this: prevention is key. Everyone should know their status, and not knowing your HIV status is not a status.
And how can people get in contact with your center, Dr. Brown?
They can walk in for HIV testing. We are open during the week, Monday through Friday. You can always walk in for a test. You can reach us at 843-402-1981. That is my direct number, and I will get you in touch with who you need to get in touch with. We are also on all social media platforms. So we're on Facebook, we're on Instagram. You can find us at the Roper St. Francis Health Services Center there. We also have a website where our RSF Health Services Center.com, and you can also find information about what we do. You can find information about our fundraisers. You can find information about sponsorships. You can find information about testing and care, all on that website.
Oh, absolutely. Good information to know. Thank you so much for your time.
Thank you. Have a great day.
Likewise.